In college, I shadowed a few doctors during my time in Boston, and it was really something I really gravitated towards. And you form connections with people at vulnerable times in their lives. Things I see most are kind of disorders of the brain-gut interaction, so like irritable bowel syndrome, acid reflux, usually unknown or sources of like abdominal pain, GI distress, indigestion. I also do a lot of preventative medicine, screening colonoscopies, surveillance colonoscopies, counseling patients who may have a family history of inflammatory bowel disease or colorectal cancer, and mitigating their risk in that way. I do a lot of nutrition counseling and dietary counseling as well. And then a subspecialty within GI that I do is deep bowel enteroscopy, usually for more occult GI bleeds or for small bowel kind of pathology. My first visits are simple. I listen to the patient. I do a thorough chart review before I see anyone if they have that information sent or it's already in the chart. But a big part of it, I start every encounter saying, what brings you in? What can I help with? And what's been going on? And I think listening and taking all that information in is the first thing I do. Following that, we go through a detailed history, past medical history, medications, going a thorough overview of their everyday diet, nutrition, and lifestyle. And then from there, we either create a diagnostic or therapeutic plan, depending on where they're at in that stage. I do a few half marathons a year, and I jog almost every day after work, about 5 or 6 miles, so I'm always training. It really clears my head, and it's like one of my favorite things. You'll find me either at a run store switching out or trying on new shoes, or running along the water or like randomly in the neighborhood.